The 2026 Social Security Cost of Living Adjustment, COLA, is projected at 2.8, offering a modest increase for beneficiaries, including retirees, disabled individuals, and survivors. This adjustment helps counter inflation, which directly affects purchasing power, especially for those on fixed incomes. While any increase is welcomed, many seniors argue it fails to match actual living expenses such as housing, medical care, and groceries. Understanding how this percentage translates into your monthly check is essential. Whether you're already receiving benefits or planning to claim soon, knowing the financial implications of this COLA is crucial for budgeting and long-term planning. A 2.8% COLA increase may sound minor, but for millions relying heavily on Social Security, it can determine whether they can afford basic necessities. For example, someone receiving $1,800 monthly could see around $50 additional per month, which adds up over the year. While it doesn't solve high costs in areas like prescription drugs, housing, or utilities, it can help with minor adjustments. Understanding how COLA is calculated and the timing of payment increases is critical. By preparing beforehand, beneficiaries can adjust their financial strategies and take advantage of even small increases. COLA is based on the Consumer Price Index for urban wage earners and clerical workers, CPI-W, reflecting inflation trends. The 2026 increase indicates mild improvement in economic stability but also shows inflation remains a concern. If inflation accelerates beyond 2.8%, beneficiaries could still feel financial strain. Historically, some years saw higher COLA increases, such as 5.9% in 2022, when inflation skyrocketed. For those living solely on Social Security, this lower adjustment may require tightened budgeting or seeking supplementary income. Understanding these economic indicators helps predict future benefits and prepare for financial challenges. Retirees often feel most affected by insufficient COLA increases because they face higher healthcare costs than younger populations. Many must use a significant portion of their Social Security income for prescription drugs, medical insurance premiums, and long-term care. A 2.8% boost may provide slight relief, but rising Medicare Part B premiums could offset gains. It's important for retirees to compare net benefit increases after these deductions. Financial experts recommend reviewing annual benefit statements and preparing strategies such as using Medicare Advantage plans or supplemental coverage to retain as much of the COLA adjustment as possible. Those with disabilities often experience financial instability due to medical needs and limited employment opportunities. For them, the COLA increase holds significant meaning. The 2.8 adjustment applies to Social Security Disability Insurance, SSDI, and Supplemental Security Income SSI recipients, potentially easing burdens such as therapy costs, mobility aids, or housing. However, assistance programs don't always adjust at the same pace, causing gaps. Recipients should verify how the increase influences eligibility for additional benefits like SNAP, Medicaid, or low-income energy assistance. Tracking total income changes can help avoid unexpected coverage reductions. Survivors, including widows, widowers, and dependent children, will also benefit from the 2026 COLA. This increase can help with monthly living expenses, especially for those who lost a primary income earner. Although the percentage seems modest, any increase can support financial stability for vulnerable families managing after a loss. However, survivors should be cautious, as higher benefits may slightly impact eligibility for other support programs or tax filing status. Consulting a financial advisor or reviewing IRS income guidelines may help avoid unintended consequences. Planning ahead ensures survivors keep the maximum benefit. With COLA set at 2.8, seniors and other beneficiaries must calculate how this change affects their daily budgets. While the increase may cover minor expense rises, it won't solve long-term financial challenges such as housing or elder care. Beneficiaries are encouraged to evaluate overall spending and consider steps like downsizing, using senior-specific discounts, or accessing local assistance programs. Experts also suggest reassessing insurance plans and exploring medical cost-saving options. Creating or updating a monthly budget before the COLA adjustment takes effect helps maximize the benefits and prevent potential overspending. Understanding when the increase will take effect is key. The COLA adjustment begins with January 2026 payments, typically received in January based on each person's birth date. Beneficiaries should review their Social Security Administration SSA account or annual benefit letter to see exact figures. Those who set their budgets monthly need to account for the change beginning at the start of the year. Planning early helps avoid surprise expenses. SSA typically announces COLA updates in October, giving several months for beneficiaries to prepare, research options, and adjust financial strategies accordingly. The 2.8% COLA is one of the lowest increases in recent years compared to the high inflation period seen in 2021-2023. While inflation has slowed, essential cost sectors, like healthcare, continue rising disproportionately. Seniors may not feel the full effect of the adjustment if expenses surpass the COLA rate. Financial advisors recommend exploring supplemental income strategies such as part-time work, pensions, savings accounts, or investments. Ensuring benefit optimization may involve delaying retirement or coordinating benefits with spousal income. Even small adjustments in claiming strategies can lead to higher long-term payouts. Retirement planning experts recommend combining the COLA boost with other financial strategies. Although small, the increase can be used to fund emergency savings or cover rising costs. Some retirees choose to allocate the additional funds toward debt reduction, healthcare costs, or future planning. Using budgeting apps or consulting senior financial assistance services are useful tools. Beneficiaries should monitor inflation trends throughout 2026 to determine if additional financial adjustments are necessary. Even minor COLA increases can improve financial resilience if strategically managed. For individuals still working and not yet retired, the COLA projection may influence retirement timing. A larger benefit payout post-retirement can occur if claiming is delayed, but inflation adjustments must be considered. Those planning to retire in or after 2026 should review their retirement benefits using SSA calculators. The 2.8% increase boosts future payouts but won't compensate for early claiming penalties. Strategic planning may include postponing benefits, optimizing spousal benefits, and contributing to retirement accounts. Consulting a licensed advisor is recommended to create a personalized strategy based on projected COLA rates. Living in high-cost states may reduce the impact of the 2026 COLA increase. Beneficiaries in areas like California, New York, or Florida may struggle more compared to those living in states with lower housing and tax burdens. Some seniors consider relocating to more affordable states or communities where their Social Security income can stretch further. Additionally, reviewing state-level benefit programs or senior financial relief initiatives could help. It's important to factor in healthcare accessibility, climate, and family proximity before relocating. Effective planning allows beneficiaries to fully benefit from the COLA increase. Medicare can significantly influence how much of the COLA increase remains in hands. If Medicare Part B premiums continue rising, they can offset gains from Social Security adjustments. Experts strongly advise reviewing annual Medicare updates and considering alternatives such as Medicare Advantage or supplemental insurance. Beneficiaries should make comparisons based on their medical needs and financial capacity. Planning for healthcare expenses should occur simultaneously with COLA adjustments to avoid financial strain. Evaluating costs against expected income helps preserve as much benefit as possible for daily living needs. The COLA increase also highlights the importance of keeping an up-to-date My Social Security account. Beneficiaries should review their estimated benefits annually and update contact information to ensure accurate notification. Checking benefit statements can clarify how the 2.8% increase applies and provide insight into overall finances. This online portal provides tools for tracking future changes and submitting claims or adjustments. Staying proactive with official updates reduces uncertainty and allows beneficiaries to respond quickly to changes. Being informed ensures smoother financial planning and more efficient benefit optimization. Some policymakers and advocates argue that the current COLA formula does not adequately reflect seniors' cost of living. They propose switching to a consumer price index for the elderly CPI-W, which accounts more accurately for healthcare and housing expenses. If adopted, future COLA increases might be higher. While this change is not guaranteed by 2026, ongoing discussions may influence adjustments. Beneficiaries should follow legislative developments regarding Social Security reform. Keeping informed can help individuals adapt financial strategies and anticipate more accurate benefit increases in the future. Inflation trends in 2025 and early 2026 will ultimately determine the final COLA figure. Although current estimates suggest 2.8%, actual changes may vary based on economic conditions. Experts suggest beneficiaries avoid relying solely on COLA for financial planning and diversify income sources whenever possible. Monitoring inflation rates, energy costs, and housing trends is essential for proactive budgeting. Understanding economic signals can help beneficiaries prepare for either a higher or lower adjustment. Performing a mid-year financial review is recommended to stay aligned with changing circumstances and benefit optimally. To maximize the benefit of the 2.8 COLA increase, retirees and future claimants should focus on tax planning strategies. While Social Security may be partially taxable depending on income thresholds, proper planning can help reduce federal tax impact. Reviewing distribution timing from retirement accounts, optimizing spousal benefits, and leveraging Roth IRAs might help retain more income. Consulting tax professionals is recommended before the adjustment takes effect. Effective tax planning can make even a small COLA increase more meaningful by preserving a higher portion of final benefits. In conclusion, the Social Security 2026 COLA of 2.8 is a small but critical adjustment that helps beneficiaries maintain financial stability amidst ongoing inflation. While the increase will provide some relief, it may not fully cover rising costs of living, especially in healthcare and housing. Beneficiaries should proactively plan, monitor updates, and explore supplemental income strategies. Whether you're already retired or planning to file soon, understanding the implications of this adjustment empowers stronger financial decision-making. Stay informed, seek professional guidance, and use this COLA boost strategically to safeguard your retirement future.